back. So today's discussion will be on the blood supply of the femoral head. This will be an important topic and it will most probably be asked in your theory examination, and it is important for both for the MBBS students and for the postgraduates. Okay, so this is the femoral head, neck, greater trochanter, lesser trochanter, and the shaft of the femur. Now coming to the introduction, 2 points in introduction. The first one is the blood supply of the femoral head is peculiar. Why it is peculiar? Because for most of the other parts of the body, they have what is called as a collateral flow. That is, if one arterial supply gets affected, another arterial supply will be there to compensate so that the cell or the organ will live. Whereas this part of the femur is supplied in such a way that if the main arterial supply is cut, there is not much of collateral flow which can compensate for the loss, and this will result in death of the cells within the head of the femur. So it is the death of the cells because of avascularity. So that is called AVN or avascular necrosis of the head of the femur when the blood supply is cut off. So that is the first point. And the second point is two important arteries supply the femoral head. The first artery is the profunda femoris artery, which is a branch of femoral artery. This supplies nearly 80 to 90% of the blood supply to the head of the femur. And the second artery is the artery of ligamentum teres. This artery is a branch of obturator artery, which supplies only around 10 to 20% of the blood supply to the head of the femur. Right? Now, what is this profunda femoris artery? Everybody will know about this anatomical structure. This is called the femoral triangle, in which the femoral neurovascular structures are organized in the form of VAN, van from medial to lateral side, femoral vein, femoral artery, and femoral nerve. So the femoral artery lies in the middle, and close to that is the head of the femur and the neck of the femur. So when we palpate the femoral pulse in the inguinal region, you need a bony point over which you can feel the pulse, and that bony point is the head of the femur over which you are palpating this femoral pulse. So now I am drawing this femoral artery here. This is the femoral artery. One branch from the femoral artery arises close to the neck of the femur. This branch is important to us, and this is called profunda femoris artery. So profunda femoris artery is a branch of femoral artery given near the neck of the femur. From this profunda femoris artery, two branches arise. One goes around the neck in the front, that is anterior aspect. The other branch goes behind the neck in the posterior aspect. So this branch, which originates from the profunda femoris artery and goes laterally, is called lateral circumflex. Why it is called circumflex? Because it goes around the base of the neck like a ring. So this anterior branch which goes laterally is called lateral circumflex femoral artery. And there is another branch which arises from the profunda femoris and goes medially behind the neck of the femur. That is why these dotted lines. So this is called medial circumflex femoral artery. So this is the neck of the femur from the posterior aspect, and here comes the medial circumflex femoral artery, that is behind the neck. So you should know femoral artery, profunda femoris artery. The branch which goes anterior or move towards the lateral side is called lateral circumflex femoral artery, and the branch which goes medial, rotates and goes behind the neck of the femur is the medial circumflex femoral artery. These two arteries together form a circle or ring. What is that ring called? It is called extra-capsular arterial ring. Why it is called extra-capsular? Now coming again, this is the head of the femur, acetabulum comes here and forming the hip joint. So this blue structure is the hip joint capsule which covers the hip joint per se. So now as I told you, this is the anterior part. So here comes the femoral artery, profunda femoris artery. This is the profunda femoris. So this is lateral circumflex femoral artery. This structure which goes medial and behind is the medial circumflex femoral artery, and these two together form a ring that is called extra-capsular. This ring is outside the capsule. That is why it is called extra-capsular arterial ring. So this is extra-capsular arterial ring. Similarly, this is the posterior part. So this is one artery, another artery comes from the back, and these two together form extra-capsular arterial ring. Okay. Now, what are these ascending cervical arteries? From this extra-capsular arterial ring, arterial branches course along the surface of the neck of the femur. Okay, from here it goes front and back of femur. So these branches which arise from the arterial ring and goes along the surface towards the head of the femur are called ascending cervical arteries. It is called ascending because it is going up, and it is called cervical because it is along the neck of the femur. That is why it is called ascending cervical arteries. Okay. Now, all these ascending cervical arteries, so this is the extra-capsular arterial ring. These are the ascending cervical arteries. Once they reach the capsule, these are called by different names. These are called as retinacular arteries. Once they are inside the capsule, this is called retinacular arteries. The same arteries continue within the capsule as retinacular arteries. And all these retinacular arteries form a ring along the base of the head of the femur. Okay, so this ring is called intra-capsular or subsynovial arterial ring. Why it is called intra-capsular? Because this ring is within the joint capsule, within this blue structure, or is otherwise called subsynovial, that is inside the joint arterial ring. Okay. Similarly, this is the posterior aspect. This is the medial circumflex femoral artery. So lateral circumflex comes in the front, ascending cervical arteries. Within the synovium, these are called retinacular arteries, and these together form the intra-capsular or subsynovial arterial ring. From here, the blood vessels supply the head of the femur. Okay. From this intra-capsular ring, multiple branches supply various parts of the head of the femur. So this is the main point you have to remember. Now, I told you another artery that is called artery of ligamentum teres. You see this round structure in the head of the femur, this is called fovea capitis, and this is the place where ligamentum teres is attached from the head of the femur to the acetabulum. Okay, so this is acetabulum. So inside this ligamentum teres, one artery comes. That artery is called artery of ligamentum teres, which arises from obturator artery. So this artery supplies around 10 to 20% of the blood supply around its insertion. So only this area is supplied by ligamentum teres, and all the remaining part of the head is supplied by this intra-capsular or subsynovial arterial ring. Fine. So now coming to the recap. Head of the femur, neck of femur, greater trochanter, lesser trochanter. Okay. So femoral artery. This is the profunda femoris artery. From profunda femoris artery, the artery which goes laterally or anterior is called lateral circumflex femoral artery. The branch which goes posterior to the neck of the femur is called medial circumflex femoral artery, and these two arteries unite to form extra-capsular arterial ring, which is outside the hip joint capsule. And from those ring, multiple ascending cervical arteries, because they ascend upwards on the neck, so it is called ascending cervical arteries. And once they enter the hip joint capsule, these are called retinacular arteries, and these retinacular arteries in the base of the head of the femur form intra-capsular or the subsynovial arterial ring, from which multiple branches supply the head of the femur, which is about 90% of the blood supply, and the remaining 20 to 30% of the blood supply is supplied by artery of ligamentum teres. Okay, so hope you guys now understand the anatomy of the blood supply of the head of femur. If you have any doubts, please mention it in the comment box, and see you soon with my next discussion. Bye guys.